All right, so PNR208, exam three review. So exam three is going to cover the concepts from weeks seven, eight, and nine. So week seven was infectious diseases, HIV, tuberculosis, sexually transmitted infections, bioterrorism. Then week eight was home care, community resources, case management, care of complex chronic illnesses in community. And then week eight, we talked about human abuse and violence, and cultural influences in nursing. Um, so you have your study guide. So we'll just kind of go through some of the concepts. Um, so week seven was infectious disease prevention and control, HIV, tuberculosis, sexually transmitted diseases, as well as bioterrorism and disaster. So when we look at the requirements for disease reporting in the US, those are mandated by state. They're not mandated by federal law. So I'm just trying to fix my desk. Like all loose. And so the list of reportable diseases will vary by state since it is state specific. So you can go to your state health department and you can look to see what diseases are reportable based off of that. Um, State health departments on a voluntary basis will report cases of selective diseases to the Centers for Disease Control and Prevention. So again, just always refer to your state specific health department. Um, when we look at communicable diseases, um, communicable diseases like in the early 1900s, they were the leading cause of death in the US. And so with improved sanitation and nutrition, the development of antibiotics or the discovery of antibiotics, the development of vaccines, has ended some epidemics, like, diphtheria, typhoid, things like that, and it has greatly reduced the incidence of others like tuberculosis, even though we still have tuberculosis. The epidemiological triangle is that host agent environment. So your agent is the disease causing microbe, whatever that may be, whether it's a virus, a parasite, bacteria, fungus. The host is, the ability or the susceptibility of us as humans to diseases based off of, our immune system, um, what our nutritional status is, making sure that we're getting adequate rest, physical fitness. We know that our risk increases if we have another chronic disease. And so, of course, hygiene also will fall into that as well. We know that proper hand hygiene is the single most important aspect of medical asepsis as well as infection control. So we'll start with hepatitis. Hepatitis is a disease that attacks the liver. So we have hepatitis A, hepatitis B, hepatitis C, which are the three most common ones. There are others that are out there. But hepatitis A is a viral illness that attacks the liver. It's spread through the fecal oral contact. People that are high risk for hepatitis A are men who have sex with men, daycare workers, and kids that attend daycare, illegal drug users, those that already have chronic liver diseases, and those, of course, from countries where hepatitis A is common. It can be prevented through the hepatitis A vaccine. It's a two-dose series. Hepatitis B is a bloodborne pathogen. You're high risk for hepatitis B or your IV drug users. people with other sexually transmitted infections or have multiple sex partners. Those also from countries that have high rates of hepatitis B, healthcare workers, inmates of long-term correctional facilities. Um, it can live on surfaces for a week. And so again, hepatitis B can be prevented through the vaccine. It's a three-dose series that we start giving at birth. And then hepatitis C is also bloodborne. High risk for hepatitis C are those IV drug users, infants of infected mothers, um, and a majority of patients that have hepatitis C develop chronic or lifelong infection, which can lead to liver damage, cirrhosis, as well as liver failure or liver cancer. Smallpox, the first symptoms of smallpox, high fever, head and body aches. Sometimes they have some vomiting. And, during those initial symptoms, they are usually too sick to carry on normal activities. Um, it is contagious when it first starts. That's when they're actually the most contagious. And then that rash will start. It starts as small red spots on the tongue and the mouth, and they change into sores that break open and then spread, the virus throughout the mouth and the throat. The fever will continue at this point as well. And then once the sores in the mouth start to break, down, the rash will start to appear on the skin, usually starting on the face, then spreading to the arms and legs, then the hands, the feet, like the soles of the feet. And then usually it will, by the time 24 hours comes, it's usually spread to the rest of the body. And then as the rash appears, the fever will start to go away. So they actually may start to feel better. Um, HIV is a bloodborne infection spread through sexual contact, sharing of needles. It also can be spread from mom to baby during pregnancy or through breast milk. Um, and with healthcare, we actually have a higher chance of contracting hepatitis B than we do with HIV. But with like HIV, should you get a needle stick, or have high risk exposure, right? We recommend the post-exposure prophylaxis, that will help to prevent, HIV from, being able to replicate within the body. Um, Other people like patients that already have sexually transmitted infections are also at high risk for HIV, especially things, if they have like chlamydia, gonorrhea, herpes, syphilis. What else? With HIV, testing is antibody testing. It can cause false negatives up to 3 months. So if there's an exposure, or possible exposure, you do the initial testing and then you want to get follow-up testing within 3 months or after 3 months. Tuberculosis is a mycobacterial disease that's spread through airborne droplets. In about 95% of people that contract HIV, it becomes latent. We screen for TB through the tuberculin skin test. If the skin test is positive, we'll ask them if they've had a recent skin test, right? 'Cause some people can develop either a sensitivity to the serum, or if they've had previous, positive in the past, they will stay positive. Um, but if it is positive, then we will send them for a chest x-ray or blood test, like your quantiferin TB gold, or the quantiferin or the TB gold or TB spot. I've heard it called different things. Um, but the definitive diagnosis for tuberculosis is through sputum sample. The problem with the sputum sample is because tuberculosis is such a small growing, or it's not small growing, slow growing bacteria that it can take up to 21 days for the bacteria to proliferate enough in order for us to get adequate results. With tuberculosis treatment, um, depending on the person and their compliance with treatment. We may have to do what's called directly observed therapy. And so that's where the community health nurse observes each dose of medication to ensure compliance. People that have tuberculosis are on these medications for long periods of time, anywhere from 3, 6, 9, sometimes longer months. And so compliance usually remains it can be an issue. And so we do the DOT therapy. They can go to a clinic, they take their medication in the mornings, they're observed, and then they can go about the rest of their day. Um, with our sexually transmitted diseases, Sarah, am I going too fast?
No, you're good. I'm listening.
Okay. Chlamydia and gonorrhea, both of those are bacterial. They are spread through sexual contact. Both are treated with antibiotics. Big thing with those is that all sexual contact should stop until treatment is completed. And any sex partner that they have had within the last 60 days should be contacted, tested, and treated as well. Be especially women with chlamydia and gonorrhea, they can be asymptomatic, but it can lead to things like pelvic inflammatory disease, which that can lead to infertility, endometriosis, pelvic adhesions, and even death if it's not treated. With syphilis, that's the one that begins as the canker or the painless sore, which is your primary syphilis. And then as it moves into the lymph system, and it'll start to cause the flu-like symptoms, which is your secondary syphilis. Um, they'll have positive tests with the or positive blood tests during the second stage, during that time when they have the flu-like symptoms. But if it's not treated within the primary or with antibiotics within the primary or the secondary stages, it can become latent um, and kind of just lays dormant, but then can be reactivated later on in life, which can lead to damage or severe damage in many areas of the body. And that's your tertiary syphilis. At that point, when it gets to that point, it is no longer curable. And so it just will progress and it will eventually become end stage. With herpes simplex or genital herpes, um, and so it's where they have they have the sores that form within the genitals. And during outbreaks, they can spread it. It's possible also to spread it during the viral shedding between outbreaks as well. One thing with herpes is it's not curable, so it is a lifelong condition. We can kind of control the outbreaks, or maybe even extend the period of time between the outbreaks using antiviral medication. Um, but one thing when using the medications too, a lot of the topical creams that they use, making sure that they use gloves when they're applying the medication and that they don't touch any other part of the body because they can actually self-inoculate. So if they have genital herpes and they put the medications on and they have any virus shedding on that glove and they or their hand and they touch other parts of their body, they can actually self-inoculate themselves as well. Um, so want to be really careful with using medications and avoiding that. It is always contagious. It can, like I said, it can spread to other parts of the body. It usually starts as blisters around the genitalia, or wherever the initial contact occurred. So, if it's an oral sex situation and, the person that is receiving the oral sex has herpes, then the person that is performing the oral sex can get herpes in their mouth. So it just depends on where the contact occurred as to where the virus is going to start. Um, the blisters will ulcerate, um, and they can last for several weeks. Um, the virus also can move into the nervous system, and it can be reactivated repeatedly. Again, we can suppress it with antivirals, and even with, with moms that have genital herpes, they can pass it to the infant during birth, if they have any active lesions and having a vaginal birth. HPV, your human papillomavirus. You can get HPV by vaginal, anal, or oral sex with someone who has the virus. It's most commonly spread through vaginal or anal sex, but it can also spread through close skin to skin touching during sex. And a person with HPV can pass the infection to someone even if they don't have any signs or symptoms or even know that they have HPV. So we do have the HPV vaccine, which is your Gardasil. It's safe, it's effective, and it protects against most prevalent infections, genital warts, your precancerous cervical lesions. But it's not all HPV infections, but some of the major ones and some of the ones that can lead to cervical cancer. Um, then we had bioterrorism and disaster. So disasters are considered either man-made or natural. Natural disasters are events like earthquakes, communicable disease, epidemics, droughts, hurricanes, tornadoes, flooding. Um, Man-made disasters, those are like pollution and warfare and fires, water supply contamination, things like that. um, After accidents or disasters occurred, um, everybody, all the people involved will be in what's called the impact stage. um, and that's where we need someone with really good, um, what's the word I'm looking for? um, be someone that can really just be able to take control, um, and to get people together in a central place, for safety as well as providing information and direction. um, as nurses, think about being in a hospital or a long-term care facility or somewhere and disaster occurs. Getting the CNAs to move all the patients from the accident or the danger. It's always safety first. We want to try to get as many people out of the way, out of harm's way, I should say, um, as soon as possible. Um, Other things with disasters, water can be considered safe for drinking by boiling for 3 to 5 minutes, using like, a milliliter of bleach to a gallon of water and letting it sit for 30 minutes is another effective way. You can drain water from hot water heaters. That also is usually safe. Um, for chemical spills, um, you don't want to touch the clothing. You want to use tongs or something to remove clothing. For, any kind of vesicle agents like mustard gas or things like that. that can lead to, eye and skin and respiratory complications, especially with mustard gas. You don't want to get it wet. You want to try to remove, the clothing and get them decontaminated as quick as possible, avoiding getting it on you as well. Nerve agents like your sarin gas can cause respiratory complications, severe respiratory distress. Blood agents like cyanide can cause dermal as well as respiratory complications. And with any disaster and any chemical, whether it's man-made, whether it's natural, whether it's chemical. You always follow your ABCs, right? Airway, breathing, and circulation when providing care. And then we had our home care, community resources, and case management, and care of some of the complex illnesses in the community. So home care. Um, right, we're practicing within the client's home, and we're providing individualized care to those clients. Um, it's not an everyday thing. You're not in that client's home every day for 8 hours a day. Most of the time, home health care is intermittent. Um, and so, one of the biggest things that home health nurses will do is to facilitate self care so that the clients can remain in their home. So, we provide a lot of education about medications, about treatments, how to manage your chronic illnesses. So, that's a big part of what we do as home care. That allows clients to have some control over their life. It also helps to prevent hopelessness, helps to prevent loss of self-esteem. Um, During the assessment phase, that may take a little bit longer for nurses, especially when we're working in clients' homes. Remember that you were a guest in their home. And so one of the big things that we have to do is, kind of earn the trust of the family. We have to establish a partnership, with the client as well as the family. And you kind of, think about it, you're not in a hospital, you're not in a long-term care setting. So you're not going to always have, the supplies that you need like readily available. And so when you're looking at, that assessment too, you're looking at the client, you're looking at what supplies are available, what equipment they need, what equipment they have. Um, and so, just it's not just assessing the client, you're kind of looking at the whole home as part of it. Um, you also, again, we're caring for the individual, caring for the family, providing the education, making sure that the environment is safe, and that they have the necessary tools, in order to, provide for themselves when the nurses are not there. Um, with healthcare. Trying to think of what else. It's just you know, people, used to stay in the hospital for long periods of time because of, IV medications, complex wound care, even some surgical procedures, respiratory treatments, and things like that. And so it has made a big change, right? People can now go home with this complex equipment. Um, the Omaha system is the system that is typically used for home health nurses. It was developed by home health nurses, um, and it's based specifically on what the home health nursing documentation needs. So it can organize, sort, document all the pertinent data that they need. Again, it's mostly for home health nursing. No other nurses use the Omaha system. Um, what else? Um, community resources are used to enhance self-care, manage complex illnesses, reduce vulnerability in our vulnerable populations. So we have things like our health departments, which are nonprofit organizations. We have volunteer organizations. We have things like Meals on Wheels, the American Red Cross, food and clothing banks, crisis pregnancy centers, domestic abuse shelters, churches, transportation services, other, sitter services, things like that are available within the community. Um, and we talked about, how some of those resources are effective. We talked about how we working with, largely non-English speaking immigrants community, right? We can get with their community leaders, whether it's, a layperson or even a religious leader, and develop a relationship with the leaders that will help to um, enlist their help in developing a plan to reach those, non-English speaking communities, to, provide resources, education, to let them know what's available within the communities. We can reach out through like radio stations, TVs, even some of those communities may even have their own like newspapers where we could also advertise. Um, Case management, those are activities implemented with individual clients in the system. And so, case managers, it's very labor intensive. It's a lot of work, in managing clients. Um, they coordinate care across different healthcare providers. They can help to arrange transportation. They can give them guidance about disease processes. Um, Trying to what else? They, help to find community resources. What else do they do? They do a lot. But it's just, they need to be very knowledgeable about, diseases and available resources, even how things are funded. They need to have really good written and oral communication skills, documentation skills, good negotiation, conflict resolution skills, and being really able to use critical thinking processes, because they're going to need to identify as well as prioritize patients' problems. Um, Patient problems, not only from patient's point of view, but also from the provider. So they're kind of that go between the providers and the clients and offering that information. And they provider may give some information regarding the client, whether it's proper management of diseases, educational needs. Sometimes the clients don't always see that is the same issue. So being able to kind of be the go-between person is really important. Um, and not everybody qualifies for case management, because it can be very costly for organizations to provide case management. Again, it's very labor intensive, very time consuming, because of many of these case managers have a lot of different patients that have complex problems. And so, they're it can be very overwhelming, and without having good time management and documentation skills, it could get a little out of control. Um, it does in the long run, hiring case managers and having case managers within organizations or even within health insurance agencies. It does help to save money in the long run for those companies because they're providing more like a lot of health and health promotion. Um, but like I said, not everybody that has a complex illness is going to have a case manager. Um, It's just, the ones, a lot of it is, you're newly diagnosed, or some of your patients that are just, where the disease is not well controlled. Um, what else? We looked at care of complex illnesses in the community. This was like your post-op care, your COPD, your cirrhosis, or not cirrhosis, yeah, cirrhosis, your diabetes, your peripheral artery disease, your chronic venous insufficiency, hypertension, that kind of thing. With post-op care, airway, breathing, circulation, right? That's always going to be the priority. Um, Pain is another one. Um, so some of the post-op complications related to respiratory system could be your pneumonias, your pulmonary embolus, your atelectasis. It could be respiratory depression as a result of pain medication or anesthesia. Um, with circulation, they could develop DVTs, dehydration, due to decreased intake. A lot of patients, obviously, prior to surgery, they're going to be MPO. And so if they're not hydrated well or given IV fluids during the procedure, they could dehydrate, which could lead to issues. Um, Other potential complications would be urinary tract infections from the use of catheters, so your catheter associated UTIs, um, skin infections from, the surgical procedures. Um, Wound healing can be a potential issue, especially in patients with other chronic disease processes. Like, think about your diabetics, development of pressure areas, especially with some of your complex surgical procedures or procedures that, require patients to be bedbound for a period of time. The development of pressure areas is something that we need to look into and to try to prevent. Of course, pain after surgery is something that needs to be managed effectively for proper healing to occur, as well as to prevent some of the other post-op complications, like, the atelectasis and the pneumonias, especially, think if they've had like a abdominal surgery, chest surgery, making sure that, we're providing measures for splinting, right? So they can take those deep breaths, turn, cough, deep breathe. Um, Other ways to prevent some of the post-op complications, making sure that we are using aseptic technique when we're changing their dressings. Incentive spirometry is another one. Encouraging oral intake. Trying to think what else. Um, giving the DVT prophylaxis, whether it's heparin or enoxaparin, using the sequential compression devices. Trying to think what else, getting them up and moving as soon as possible after surgery. Um, Using stool softeners or laxatives, especially for those that have been on pain medicine. It's constipation is one of the potential side effects of that. Um, what else? Um, Week 9, we talked about human abuse and violence and cultural influences. And so some of just the highlights from that, since we just had that lecture, one of the top risk factors for intimate partner violence is a previous domestic violence. I'm sorry, one of the risk factors for intimate partner violence or homicide, geez, can't even say what I'm trying to say, is previous domestic violence. Some of your leading risk factors for suicide or depression, other mental health disorders, substance abuse disorders, other risk factors would be a prior suicide attempt, family history of suicide, mental disorders, substance abuse or violence, having firearms in the home, incarceration, exposure to suicidal behavior of others, whether it was family, peers, or even people within the media. Um, what else? People who become involved in violence typically had previous exposure to some sort of violence. Abusers were often beaten when they were children, or they witnessed siblings or one of their parents being beaten, so that they learn that that is, an appropriate way to manage conflict. Um, Parents with low social support, a tendency towards depression, stress factors, history of abuse, are at risk for abusing their own children. Abusive parents often have unrealistic expectations of their child's developmental abilities, right? So, one of the preventative measures, right, is to teach parents about normal growth and development, so that they understand the normal process and what to expect during different stages of development. We talked about nurses being mandatory reporters, especially for our vulnerable populations like the elderly and our children. With adults, we always ask permission and discuss that, the reporting with them, because if they don't have a way out, aren't ready to leave, that kind of thing, the partner finds out, it could actually increase the risk for violence. So when you're with adults, it's a little bit different situation. Um, and then with our cultural influences in nursing, we know culture is everything we believe to be true about the world. It's our beliefs, our values, our assumptions about life. And we pick that up through socialization in childhood. Different ethnic groups may have cultural similarities, but we always treat everybody as an individual, right? Just because you're a part of one cultural group does not mean that you practice everything within that cultural group, right? So each person is treated as an individual. Um, and so culture too, and includes language, the use of touch, personal space, body language, or yeah, body language, what else? Perceptions of health and illness as well. So, the best way to find out about somebody's cultural preferences is to always ask them what their preferences are. So we approach each person as unique. Again, we don't just assume because they are a member of one culture that they are going to, include all the parts of that culture within their practice. All right, now questions. What questions do you have for me?
I don't have any questions. A lot of the stuff that was covered, we also covered in med surge within the last like few months as well.
Oh, okay, cool. So you got like a double shot.
Yeah, at least within the last few months. So I don't
Cool.
have any questions as of right now.
All right. Well, if you think of anything and you need any clarification, just feel free to reach out to me.
Okay.
All
Well,
right.
thank you so much. Have a good night.
You too.
Thanks.
Bye.